appreciate you joining us for another edition of DermTube Daily Coverage from the American Academy of Dermatology. With us today is Sheila Fallon Friedlander, who's a professor of medicine and pediatrics at the University of California, San Diego. And she's going to be telling us about her presentations related to the workup of birthmarks.
Hi, good afternoon. Yeah, I'm very excited that we've got a course this year that's about birthmarks and how to work up children who come in. I think dermatologists are often really frightened when they see a baby come into the office with a brown, white, or red spot, and what do you do, and how aggressive should you be in evaluating it?
So in terms of the algorithm that we go through in our head, where these things are located, and midline defects, and can you tell us a little bit about the thought process as to how we take care of these patients?
Sure. So in our course, we actually have it divided in terms of midline lesions and then vascular lesions in red, white, and brown. So let's say you're dealing with a vascular lesion that's midline. If it's over the lumbosacral area, it's a little hemangioma, or it's a larger red stain, you need to worry that it's a sign that during development something went awry and that the zipper that's supposed to close up when we're making our neural tube didn't close right. So in those children, if you have a lesion in the lumbosacral area that's bumpy, that's related to hairs, that there's a dimple, anything going on, you really need to do an MRI on those children to make sure that spinal dysraphism did not occur, that the spinal cord isn't tethered down, that it didn't go the right place it was supposed to. For vascular lesions on the face midline, less likely to be a problem. Every once in a while, once in a blue moon, you'll have an encephalocele, which is an outpouching actually the brain that can look sort of like a hemangioma. The trick to know that one is that it's generally a little bit lower, that it's definitely present since birth, that when the baby cries it gets bigger, and those children also warrant further evaluation. That's pretty rare. Oftentimes when you have a little angel's kiss on the forehead, and this is what most people see, so talking about what most people see, if you see a little stain here with one on the nose, say, or the eyelids, that's what we call an angel's kiss or a nevus simplex. And those lesions are completely benign and will fade with time. But sometimes people get worried, oh, it's midline, so I need to work it up. But if it's a faint stain and it has brothers and sisters, you've seen the babies born with a little mark here and here, and oftentimes they'll have ones on the back. Those aren't a concern. On the other hand, a port wine stain is, and those can be present at birth, but they tend to have laterality. They tend more to favor one side or another. Occasionally, they'll be in the center here, but if they're in the center here, they don't generally have other spots related. And obviously, with port wine stains, we need to be a little more concerned. And there's some breakthroughs in terms of port wine stains, in terms of what do we worry about always? We worry about Sturge-Weber. And we used to think that it was dependent on how the nerve, whether the port wine stain followed the path of the nerves. And there was a recent study by Kinsler, and it was published in the British Journal of Derm, where it was a matter of whether the forehead's involved or not. So that is fascinating. It made us rethink how we work those up. If any part of the port wine stain involves the forehead, according to her study, that's when you need to worry about Sturge-Weber. Those are the kids who absolutely need to have their eyes examined and they need to be followed. Now, have we thrown the old rules away? Completely no, but it has raised my index of concern when I see any part of a port wine stain. That's a lesion that doesn't leave. It's not the angel's kiss that involves the forehead. So that's pretty exciting.
We appreciate you joining us and
Sure.
sharing these updates with us, and thank you all for being with us for another issue of DermTube Daily Coverage from the American Academy of Dermatology.